Man don't live off of the hype, huh? Real thing, eh?
You are now listening to Surroundor MD.
Sorrel Garmdi, you ever met the type of person that likes to make a mountain out of a molehill? You know the type. They make life a lot harder than it needs to be. See, I ain't with that type. I like to make things simple and easy to understand. And today we're going to be talking about the vertebral anatomy, and we're going to try to make this simple and easy to understand. Right. First, I'm just going to talk about some definitions. The term spine. I think the term spine is a vague term, all right, because what are we talking about? Are we talking about the osseous elements of the spinal column, or are we talking about the spinal cord and the cauda equina? Well, I want to make it really clear in this video, I'm going to be talking about the osseous elements of the spine, and specifically, we're just going to be talking about a single vertebral level. You can understand a single vertebral level, you can integrate that to understand the entire spine, and then you can start moving forward into understanding and performing spine interventions. So let's just take a look at this spinal vertebral level. This is a lumbar vertebral level, and you can see there's kind of a front and a back to the vertebral level. The front part is this blocky portion, and that's referred to as the vertebral body. And then posteriorly, we have the posterior elements. All right? The posterior elements are a lot easier to understand if we flip the vertebral body under and kind of take a look at it. We can see those posterior elements form a ring. That ring is encircling the spinal cord or the cauda equina. So the posterior elements form a protective covering and ring around the sensitive portions of the spine, the nerve elements, the cord, and the cauda equina. All right, so let's just take a look again at the vertebral body itself. All right. You can see it sort of looks rectangular in a lateral view and has kind of a circular appearance kind of on the bottom view. As we kind of move from the vertebral body into those posterior elements, these are all named. Basically, you have the pedicles right here. So the pedicles go straight back from the vertebral body. All right, pedicle in Latin means little foot. So this is kind of a little foot-like projection which juts off the vertebral body and starts to form that ring. That's the pedicle. As we move laterally, we get the transverse processes. All right, the transverse processes are on either side. They are prongs of bone, and what they're used for is for attachment sites of muscles. So importantly, the psoas muscle, which is a strong muscle that lines the back of our abdomen, that actually attaches to the transverse process of the lumbar vertebrae. All right. As we move back in the ring, we go from the pedicle, we go medially, we get these thin kind of flat pieces of bone. This is what's called the laminae. All right. The way I remember this, I think of the word laminate. So laminate means to bring together, and the two laminae sort of come together to form that spinous process. Right. So the two laminae come together, form that spinous process. We can see that spinous process there in the lateral view. That's another piece of bone that sort of juts out. So the spinous process is an important attachment site for strong ligaments that hold the spine together. All right. So there's an interspinous ligament that goes between successive spinous processes, and that gives stability and strength to the back part of the spine. So lastly, I just want to talk about the superior and inferior articular processes. These are a little bit harder to understand because they actually interact with levels above and below. A lot of people incorrectly refer to them as a facet joint, but actually at a single vertebral level, you don't have a facet joint. You only have a facet joint at two levels where one level interacts with the other. All right? So at one level, you have what are called the superior and inferior articular processes. So this is the superior articular process. This is the inferior articular process. These processes interact with one another to form these facet joints. So the superior articular process of a single lumbar level will interact with the inferior articular process of the level above and form a facet joint. All right, that's a real joint that's going to have cartilage lining it on the inside, and it's going to have a joint capsule, and it's going to have synovial fluid. All right, but at a single level, we don't have a facet joint. We have the superior and inferior articular processes. All right. So that is pretty much it. That is all the anatomy you need to know for a single vertebral level. Once you understand this anatomy, you can sort of move forward into performing spine interventions, things like lumbar punctures, facet joint injections, and of course my favorite, kyphoplasty. So there you go. That's vertebral anatomy made stupid easy. Hope you guys enjoyed this video. Go ahead and click like below if you like this video, or subscribe for additional content. Feel free to leave me a comment below in the comments section with any ideas or suggestions you have. Hope you guys enjoyed this video. Thanks everyone for watching. Take care. It's Rogarmd.